Hello, my name is Catherine Klammer, and I'm one of the OBGYN PGY3 residents here at the Cleveland Clinic Foundation program. Today I have the privilege of presenting our project titled Bridging the Gap, a high-fidelity obstetric trauma simulation among multidisciplinary residents. This was a project that was created and conducted here at the Cleveland Clinic by myself, my co-resident, Dr. Olivia Neumann, and our attendings, Dr. Higgins, Dr. Asfaw, and Dr. Amy Hahn. Trauma in the obstetric population has an incredibly high mortality rate and requires a multidisciplinary team, including obstetrician gynecologists, general surgeons, emergency medicine providers, and anesthesia providers. Luckily, obstetric trauma is not very frequent in the real world, and therefore we set out to create and conduct this simulation experience for trainees to gain confidence and skills in managing obstetric trauma. We chose a simulation experience because simulation has been shown to enhance teamwork and communication by allowing trainees to practice not only role assignment, but closed-loop communication, as well as skills regarding debriefing serious events. It provides a safe and controlled environment with hands-on experiences to strengthen skills, enhance communication, and therefore improve patient outcomes. The course that we created was developed by OBGYN and general surgery providers. It was designed as a 4-hour simulation-based course consisting of 2 scenarios with different clinical topics and learning objectives. Our topics included primary and secondary survey, cardiac arrest, and hemorrhage. The structure of our training had 3 rooms. It included a pre-brief at the beginning with an orientation to the simulation environment, a high-fidelity simulation experience with the debrief, a didactic session, and then scenarios that involved skill stations, and then concluded with a wrap-up and survey administration. Our high-fidelity simulation experience was a preterm but viable pregnant patient who was involved in a motor vehicle accident with an open fracture who subsequently developed cardiovascular arrest requiring a resuscitative C-section. Once the patient was stabilized, she then subsequently developed a postpartum hemorrhage, which had to be managed by the team. Our didactic session included information regarding managing trauma specifically in the obstetrics population, and our skill station included how to perform a FAST scan, how to place an intraosseous IV, as well as reviewing radiographic imaging specific to obstetric trauma. Overall, on a scale of 0 to 9, those who participated in our experience, both OBGYN and general surgery residents, rated their learning during the session at an 8.25 out of 9, and their experience using simulation also at 8.25 out of 9. Feedback was overall positive, including that the lecture, simulation, and skills labs were helpful for developing our own skills and knowledge, as well as high praise that the simulation experience was multidisciplinary, involving multiple different specialties. Our future directions for this project include simulations of other common obstetric cases requiring multidisciplinary care, as well as repeating the simulation with additional providers outside of OBGYN and general surgery, such as critical care providers, emergency medicine, and anesthesia providers. Thank you so much for your time.